KEYNOTE-057, which we also updated at GU ASCO 21. It was a single-arm study that looked at pembrolizumab in BCG-unresponsive non-muscle-invasive bladder cancer. There were two cohorts that were evaluated as part of this study. Cohort A are the patients with BCG-unresponsive CIS with or without papillary disease, and Cohort B are the patients who have papillary disease only. Cohort A is the only data set and cohort that's been presented and has been presented in the past in the update that we provided at GU ASCO 2021. Cohort B is still enrolling. We still have a few patients left to go. And at the update, what we had is essentially greater than 3 years of follow-up for the patients who were enrolled in that study. It was 102 that were initially submitted as part of of the FDA submission. Ultimately, 96 patients actually met all the strict criteria that the FDA outlined in 2018. And with this extended follow-up, the CR rate is still the same. It's about 41% in those 96 patients. The median duration of response is 16.2 months. That hasn't changed. But what we see is now with extended follow-up of 3 years or more, what we see is that the patients who had, responses that are lasting 12 months and longer, those patients are still in a response. And what it highlights is essentially is that, much like we saw in metastatic bladder cancer, is that there's clearly a subset of patients who have durable responses, complete responses, many of whom can be off of treatment, and that response is sustained. And this is particularly meaningful because it basically translates to about 1 in 5 patients where you're going to see this, where they have such an excellent response that lasts a long time. And to me, what that reflects is systemic immune activation against bladder cancer. That is, CIS is traditionally treated with intraluminal therapy, cystoscopies, and then, intravesical therapy. Salvage chemotherapy is the most commonly used, gemcitabine and docetaxel. You get responses from it, but it's rarely, if ever, durable. And so you're going to expect that the cancer is going to recur. So the subset of these patients actually can do quite well and avoid a cystectomy, which is the main thing that we're trying to do with this therapy and future therapies as well, is try to avoid cystectomy if at all possible.